On Monday, NTV brought to the fore the serious challenges facing Nakasero Blood Bank, Uganda's central blood collection point.
These are the crates we use for storing our blood in the walk-up cold room. But now they are empty. That means we don't have blood.
The institution needs about 12 billion shillings to fully get back on its feet between now and June. According to Dr. Dorothy Chaine, the Executive Director, Uganda Blood Transfusion Services, the problem got worse following the cancellation of funding from the US government and a PEPFAR, which covered 45% of the blood collection needs and mobilization by the blood bank. Due to the huge funding gap, Nakasero Blood Bank now has inadequate fuel and therefore cannot conduct countrywide blood donation drives and mobilization.
Our activities are transport related. Every day teams go out in the communities, in the field to collect blood. They need fuel, they need sound vehicles, we need allowances for staff, which money was being supported by the PEPFAR project, which ended. So we are struggling.
The Minister of Health has acknowledged the funding challenge but says the solution is being worked out.
We've already got in touch with the Minister of Finance and we hope that something is going to be done very soon, maybe in the next 2 or 3 weeks, so that we can continue with the supplies.
But this may be a tall order since the 2018-2019 budget framework paper, the draft of the next national budget, indicates that Nakasero Blood Bank could suffer 5.4% cut in funding from 9.4 billion shillings this year to 8.9 billion shillings in the new financial year. Members of Parliament have blamed the funding gaps to such a critical institution that deals with matters of life on failure to prioritize.
Tear gas. In the police always have reserves of tear gas. But when they tell you that people need blood, and they tell you that out of their 1,000 units, blood bank should be keeping per day, there's only 80 units. It tells you how dangerous, how terrible our prioritization is.
Can only make an appeal. It starts with us. Maybe we invite the blood bank to start the blood donation process from Parliament, and will be more than willing to donate.
That we must change this business of putting more money on politics than on development, of putting more money on regime survival than on development.
Urge the blood bank to think outside box. If they don't have capacity, if they don't have resources to donate blood, let them use other avenues. I give one example. Right now, as I speak, there is blood donation in Lira taking place. They are not the ones who facilitated it.
The blood banks routinely engage partners like Rotary Uganda, MTN Uganda and NSSF to mobilize blood donation drives, but the sustainability of these initiatives is not guaranteed. According to the World Health Organization, Uganda, which has a population of over 35 million people, is expected to collect at least 300,000 units of blood annually. But last year, only 240,000 units was collected, leaving a 60,000 unit shortage.
I also want to use this opportunity to appeal to Ugandans that we have no factory to manufacture blood. Blood comes from individuals, so many people should really turn up to donate blood, because today it's somebody else, tomorrow it might be you.
And even those who think they will go out, before you board that plane, you may need this life-saving unit of blood.
Blood shortage puts at risk the lives of pregnant or delivering mothers, accident victims and patients undergoing surgery who could die due to the absence of blood. Sheila Nduhukire, NTV.